this computer. Okay, thanks, guys. All right, so I'm just going to do the final sprint, which means what we need to do for the last 2 weeks, which is where most of us are standing. There are a few of us, quite a number of us going this week as well. So I'll give you guys the next 1 to 2 days what you need to do. So for those of us who have a lot of time, these are a few things that you need to focus on. So at this point in time, very hard to go and memorize and learn new things. Not part of what you need to do because your brain is not really going to remember. And the one quote that I always use is this: your brain remembers the last time it tried to remember something. So train your brain to bring out what you have done. And there's no point just knowing the key points in your head because at the end of the day, this is a talking exam. If you're not, it can be here, but if this one is not coming, you are not going to score in that 8 minutes. So it has to come out from the brain and from the mouth very clearly. So say it out loud, record yourself if you don't have a partner. All right, record yourself. So look at key points. So for those of us who have exams tomorrow, first of all, please go and sleep tomorrow. If you have it on tomorrow on 9th of July, all right, just look at key points, things that you are weaker on. No, not too many hard and fast rules. Just brush up the red flags for you. Make sure that every station you enter, you know your strategy. That's it. Because content should be done by now. It's already in your heart and in your head. For those of us who still have time, please practice under exam conditions. The reason why I recommend trial exams is because it sees whether your brain can sustain with you from station 1 to station number 16 or 20. Your brain needs to be able to work. Many times when we practice role play with partners, we do very topic-wise. We only do a cluster or we do a particular OBG or psych. We don't spend time mixing our brains. But remember, in the exam, your brain goes crazy because first you have PEEP, then you have psych, and then you have med-surg, you go PE. So you need to train your brain to think fast in different settings. It's all about training the brain to be ready for that exam condition. So you can have little content, but if you have trained your brain good enough, you can actually figure it out and give them all the key points that they need. And take note of where your key mistakes are usually. I remember for me, my mistakes used to be I don't ask enough differential questions sometimes. So try to remember that differential questions in history, and if you have a specific task on differential diagnosis, they are marked differentially. They're independent of each other. So do your differentials, intertwine them into the history taking, get the key questions out. And when you are saying the differentials, again, I always mention prioritize selections, a new word that I learned from the handbook. Prioritize selection. So give what is most possible according to the age range and of the person, and then give all your other differentials. Please, there's no point in telling me someone has primary ovarian insufficiency in a 19-year-old kid which has amenorrhea. Does not make sense. It's very clear and evident you do not know clinical things as well. Of course, it comes out in panic. It's not because you don't know. But in panic, if you're going to say that the example, this doctor doesn't know the clinical very well, the premature ovarian insufficiency primary happens a bit when they're older, not when they're this young. So remember these things, work on them, say the right things. And I am building up checklists and mind maps, which I'm trying my best to. So if you already have your own ones, please review them. And I always say, don't chase the recalls. Please, if you have exams in July, don't study based on recalls. And funny enough, people who study just the recalls do not really make it past the exam. I've seen people who get an 8 and then they're like, oh, so what did you do in the last few days? Oh, don't laugh. I only looked at recalls. It is very evident when you enter that station, if you really know what's going on, you stop being holistic. You stop asking all the important questions. Now, remember, the exam is having layers of answers. So the more you get, the higher your score. All right. And you have worked hard enough. Please trust yourself. I think in my first experience when I failed, I was very recall driven as well. Second attempt, no recalls. I trusted the people around me, my knowledge and my practice and your revision. And I think you guys know enough. You guys know a lot. All right. So work on that part. All right. So now the last few days, those who are having exams this week, this is what you need to do. Please start resting, start drinking up, start eating well. I always recommend a painkiller. I know not the best prophylaxis, but migraines happen. Okay, an aspirin or a paracetamol 500 mg, 1 or 2, depending. Usually I take 1 because it's just prophylaxis, not a pain. You don't have pain to take it. And the reason why I say so, because migraines going to happen. Many people walk up with migraines, both females and males. Females, we have more migraine episodes than guys in general. So take a painkiller because you don't know when the attack is going to come. And pain in the head is not going to let you think well. Any kind of pain is not going to help you. So I recommend taking painkiller before you enter. So don't take it when you're waiting in the first floor because it takes a while for the medication to kick in and wear off. I usually recommend to take once you're inside the waiting room. So once you put your bags in the locker, right, then take the painkiller. Take the painkiller as water in the waiting room. Take it, and you should be good to go for the exam. All right. Please don't take anything drowsy. All right. I'm sure you guys know that. Sleep well. Sleep is very important, something that I learned the hard way. So sleep is very important. Please sleep and go in with a smile. Okay, your first impressions matters a lot. So go in with a smile. You have done this before. You know you've practiced so much. There's leave no room for that anxiety. Just kick off the anxiety. I know it's very easy to say. First station, you're going to have engine troubles. I had engine troubles in the first station. I failed my first station because I didn't know what was going on. I was confused. But if I think the reason why I think more candidates are passing recently, the ones who work with me, is because I tell you exactly what you're gonna face, and now you know what you're gonna face. And let me tell you, there are times the patients might scream. So if you have, I remember my friend told me that in the cervical, in my case, the patient was crying and screaming for cervical shock. So because my friend told me about it earlier, she went for the exam a few days before, and she told us that, oh, my patient screamed. So I was prepared for patient to scream. I didn't panic when the patient screamed because I know they are role players. They are one of the best role players out there. They're good actors. They're gonna go do their role very well. And so are you. You're gonna do your role really well. All right. This is my last slide. Okay. So we have done so much financially, mentally, family sacrifice, health sacrifice to be here. All right. So this is not the time to let doubt get in the way. This is not the time for any of that. So go there, give it your best shot. All right. Any questions for you guys? All the very best. I will be texting you guys personally if I know your dates. If I know your exam dates, I will be getting in touch with you personally. Otherwise, any questions for me or about the exam? A couple of you this week, so all the very best. I'll be a text away once you finish your exam. If you need a listening ear, if you're fine, you don't want to I won't disturb you until you disturb me. Okay, I'm not going to come there and disturb you. I don't really do that. So if you need a listening ear, then I'll be there. Any particular questions? If not, we'll wrap it up for today. All right. So all the best. Please nail this. Okay. It's crackable. It's really crackable. So let's crack it together. All right. And text me on the phone if anything. Okay. I'm going to end the recording and then I will end and I'll keep the